Scene script. Have you ever wondered why ovarian cancer is often referred to as the silent killer? It's because this disease stealthily develops, often unnoticed until it's too late. Ovarian cancer, a formidable adversary, is a condition where abnormal cells within the ovary begin to multiply out of control, eventually forming a tumor. This process can occur so subtly, so insidiously, that it often evades detection until it has advanced to a dangerous stage. But what exactly are these ovaries that we're talking about? Well, these are female reproductive glands, the silent workhorses that produce eggs and hormones. They keep the wheels of reproduction turning, but sometimes things can go wrong. In fact, in the past year alone, around 19,880 women in the United States were diagnosed with ovarian cancer, leading to a staggering estimated 12,810 deaths. These numbers are alarming indeed, but it's not just the statistics that are concerning. It's the nature of this disease, the way it can spread undetected from the ovaries to other parts of the body, the way it can silently take hold and cause a myriad of symptoms, from bloating and abdominal pain to changes in bowel habits and abnormal bleeding. Most of the time, these symptoms are vague, easy to dismiss as the result of a less serious condition. But persistent symptoms should never be ignored. They are the body's way of signaling that something isn't right, a call to action, a plea for help. And yet, despite the severity of this disease, there are no routine screenings for early detection of ovarian cancer. This makes it all the more important to remain vigilant, to listen to our bodies, and to consult with a doctor when something feels off. It's crucial to understand the early signs of this covert adversary, which we'll delve into next. Could it be ovarian cancer, or is it just a case of bad digestion? The early symptoms can be deceivingly mundane. Ovarian cancer, a silent predator, often lurks unnoticed until it's advanced. Its early warning signs are subtle, often mimicking more common conditions, making it a challenge to spot. Persistent bloating is one such symptom. You might be tempted to dismiss it as a reaction to that extra slice of pizza or a side effect of a busy day. But if it's consistent, it might be more than just a food faux pas. Then there's abdominal pain. We've all experienced a stomach ache from time to time. However, if you notice a recurrent, unexplainable ache in your lower belly or pelvic area, it could be your body's way of signaling that something's not quite right. Next, let's talk about changes in bowel habits. If you're experiencing persistent constipation or diarrhea, it's easy to attribute it to stress or a recent change in diet. But these changes can also indicate something more serious, like ovarian cancer. Lastly, there's abnormal bleeding. Any form of bleeding outside of your regular menstrual cycle should never be ignored. This includes heavier than normal periods, bleeding between periods, or any postmenopausal bleeding. It's your body's red flag, urging you to seek medical attention. It's crucial to remember that these symptoms can often be related to less serious health issues, but if they're persistent, frequent, and out of the ordinary for you, it's essential to talk to your doctor. Ovarian cancer is a formidable foe, but early detection can significantly increase your chances of successful treatment. Remember, your body whispers before it screams. Pay attention to these subtle cues. Not all ovarian cysts are malevolent, but a small number indeed harbor malignancy. Let's talk about these deceptive cysts. Ovarian cysts are a common occurrence in the female reproductive system. They are fluid-filled sacs that develop on or in the ovaries. Most of the time, these cysts are benign, meaning they are not cancerous. They come and go as part of the menstrual cycle, often causing no symptoms and disappearing without treatment. However, these seemingly harmless cysts can sometimes be deceptive. A small fraction of ovarian cysts can indeed be cancerous. These malignant cysts are not as common, but they pose a significant risk due to their potential to spread to other parts of the body. The danger is not in the cyst itself, but in the abnormal cells it carries. These cells can multiply and form a tumor, leading to ovarian cancer. It's a bit like a wolf in sheep's clothing, isn't it? The benign cysts appear and behave much like the malignant ones. This makes it challenging to distinguish between the two, especially in the early stages. Moreover, the symptoms of malignant cysts are often vague and easy to dismiss, further complicating the early detection of ovarian cancer. But let's not fall into the trap of fear. While it's true that some ovarian cysts can be cancerous, remember that the majority are not. The purpose of this information is not to alarm, but to inform and encourage vigilance. It's important to pay attention to your body and seek medical advice if you notice persistent or unusual symptoms. In conclusion, ovarian cysts are a common and usually harmless part of the female reproductive cycle. However, a small number of these cysts can be cancerous, and these are the deceptive cysts we must be wary of. Never underestimate a cyst. When in doubt, get it checked out. Are you at risk of developing ovarian cancer? Certain factors might increase your chances. Just as the sun rises in the east, risk factors act as the dawn to potential health issues. In the case of ovarian cancer, there are a few key elements we need to consider. First, let's talk about family history. Much like inheriting your grandmother's curly hair or your father's love for jazz, you can also inherit a predisposition to certain diseases, including ovarian cancer. If a close relative, such as your mother, sister, or daughter, has had ovarian cancer, your risk potentially increases. This is due to certain genetic mutations that can be passed down through generations. Speaking of genetic mutations, these are our second risk factor. Mutations, specifically in the BRCA1 and BRCA2 genes, significantly increase the risk of both breast and ovarian cancers. These genes are like the guardians of your cells, and when they malfunction, it can lead to abnormal cell growth and potentially cancer. Now, let's talk about age. It's a simple fact of life that as we grow older, our risk of developing many types of cancers, including ovarian, increases. The majority of ovarian cancers occur in women who are postmenopausal, typically over the age of 55. But remember, age is just a number and not a certainty. So what does all this mean for you? Well, it's crucial to understand your risk profile. Are you carrying a genetic mutation? Is there a history of ovarian cancer in your family? Are you approaching or past menopause? These are questions to discuss with your healthcare provider. Remember, risk factors do not guarantee you will develop ovarian cancer, but they do increase the likelihood. Being aware of these risks and taking appropriate preventative measures is akin to having a shield in a battlefield. Knowledge of your risk factors can be your first line of defense against ovarian cancer. Why is ovarian cancer so hard to detect early on? Unfortunately, routine screenings are not available. This is a question that many have asked, and it's one that has a complex answer. Ovarian cancer is often referred to as a silent killer. Why? Because its symptoms are subtle and easily dismissed. They can masquerade as common ailments such as bloating, abdominal pain, or changes in bowel habits. This makes early detection a formidable challenge. But why aren't routine screenings available? Well, unlike breast cancer, where mammograms can detect early signs, or cervical cancer, which can be identified through PAP smears, no such routine tests exist for ovarian cancer. This is due in part to the location of the ovaries deep within the pelvic cavity, making them difficult to examine. However, this doesn't mean detection is a lost cause. Pelvic exams, while not foolproof, can sometimes reveal abnormalities. Doctors may feel a lump or swelling on an ovary during the exam, yet it's important to note that most ovarian lumps are not cancerous, and many small ovarian cancers may not be detected by a pelvic exam. Imaging tests like ultrasounds or CT scans can also provide valuable insights. They can reveal the size, shape, and structure of an ovary. But again, these tests are not perfect. They can't definitively distinguish between a benign cyst and a cancerous tumor. So, where does this leave us? It emphasizes the importance of regular checkups and open, transparent communication with your healthcare provider. Don't dismiss persistent or unusual symptoms. If something feels off, speak up. While the path to early detection of ovarian cancer may seem steeped in ambiguity, it's not a journey you have to undertake alone. Medical professionals, support groups, and loved ones are there to help navigate this complex terrain. Early detection may be challenging, but it's not impossible. Stay vigilant and proactive. The fight against ovarian cancer is tough, but there's an arsenal of treatments at your disposal. First up, we have surgery. Now, this isn't your everyday operation. This is often a comprehensive surgical debulking aimed at removing as much of the cancer as possible. Surgeons may remove one or both ovaries, the fallopian tubes, and in some cases, even parts of the surrounding tissues. The extent of surgery is determined by how far the cancer has spread and the overall health of the patient. Next in line, we have chemotherapy. This is a powerful drug treatment designed to kill cancer cells. It's usually administered after surgery to kill any remaining cancer cells, but in some cases, it may be used before surgery. Chemotherapy is typically given in cycles, with a period of treatment followed by a period of rest to allow the body to recover. Then there's targeted therapy. This is a newer form of treatment that specifically targets cancer cells while leaving healthy cells largely unscathed. These treatments can disrupt the growth of cancer cells, block their ability to divide and spread, and even help the immune system recognize and attack cancer cells. Now here's the thing about these treatments. While they're designed to target the cancer, they can also impact fertility. That's why it's crucial to discuss fertility preservation options before beginning treatment. This could involve freezing eggs or embryos for future use. It's a deeply personal decision and one that should be made in consultation with your healthcare team. In the end, the treatment plan for ovarian cancer is tailored according to each individual circumstance. It's based on the type and stage of the cancer, the patient's general health, and personal preferences. A personalized battle plan can help turn the tide in your favor. Remember, knowledge is power, and understanding your treatment options is a crucial step in your journey towards recovery. What does the future hold for ovarian cancer treatment? Researchers are tirelessly working on new solutions. As we delve into the realm of ongoing research, we uncover a world that's filled with hope and potential for improved outcomes in the future. Pioneers in the medical field are forging ahead on a quest to conquer ovarian cancer, exploring new treatments and combinations of therapies that could potentially turn the tide against this formidable disease. One of the most exciting avenues of exploration is targeted therapy. This approach zeroes in on specific genes, proteins, or the tissue environment that contribute to cancer growth and survival, aiming to disrupt their functioning and halt the progression of the disease. By tailoring treatments to the individual characteristics of each patient's cancer, targeted therapy holds the potential to increase efficacy and reduce side effects. In parallel, researchers are also investigating the power of immunotherapy, a treatment that utilizes the body's own immune system to fight cancer. By enhancing the immune response, or by making the cancer cells more recognizable to the immune system, immunotherapy aims to give the body the upper hand in its battle against cancer. And then there is the fascinating realm of nanoparticle drug delivery. This innovative approach involves using tiny particles to deliver cancer-fighting drugs directly to the tumor, potentially increasing the effectiveness of the treatment and reducing harm to healthy tissues. But it's not just about finding new treatments. Researchers are also striving to improve early detection methods, knowing that the earlier ovarian cancer is caught, the better the prognosis. They are developing and refining tests that can detect the presence of ovarian cancer even before symptoms appear, improving the chances of survival. The ongoing research into ovarian cancer is a testament to human resilience and ingenuity. While the journey is challenging, the relentless pursuit of solutions is yielding promising results. The future is promising, and every new discovery brings us one step closer to conquering ovarian cancer. We've journeyed through the complex landscape of ovarian cancer. Now, it's time to take action. It's essential to be proactive about your health. If you've noticed any persistent symptoms that are unusual for you, such as bloating, abdominal pain, changes in bowel habits, or abnormal bleeding, don't shrug them off. These could be subtle indicators of a larger issue. If you have any of the risk factors we discussed, like a family history of ovarian cancer, certain genetic mutations, or are of older age, it's even more crucial to be attentive to your body's signals. Regular checkups and open communication with your healthcare providers are vital. They can help spot any abnormalities early, and early detection, as we know, can significantly improve the outcome of ovarian cancer. Remember, you are not alone in this. There are resources and support systems available to you. Knowledge is power, and by understanding the signs and risk factors, you've taken a significant first step. Remember, early detection is key in the battle against ovarian cancer. Listen to your body and don't hesitate to seek help.